afternoon, everyone. So, today's lecture is going to be about nerve injury and foot drop. Today's class's objectives are: what is nerve injury, classification of nerve injury, causes of nerve injury, related clinical conditions, what is foot drop, what is its causes, its symptoms.
Ouch!
You've been limping a lot lately, and I know you don't think it's serious, but I really think you should go to the doctor. Yeah, okay?
Please come in.
Good morning, doctor.
What exactly happened to you?
I was exercising in the gym a couple of days back and I suddenly felt like I pulled a nerve somewhere near my knee, and I've been feeling a very numb sensation over there and I've not been able to walk properly.
For how many days?
It's been around 4-5 days.
Excuse me, can you help her change to the examination table? Aditi, now will apply resistance on your foot. You should flex your foot towards your body. Aditi, please remove your footwear and walk normally. I've received your reports and it suggests that you're having a minor nerve injury called as foot drop. Normal exercise and physiotherapy can help you heal within a time period of 6 months.
Foot drop. A general term for difficulty in lifting your front part of your foot is known as the foot drop. Foot drop isn't a disease. It's just a sign of a neurological or anatomical or muscular problem. So when we see about the cause of the foot drop, it's just the weakness or the paralysis of the muscle which are involved in lifting your front of the foot. Or else, one another cause is nerve injury. So the peroneal nerve is the nerve which controls the muscles which are involved in lifting your foot. So when there is an injury in the peroneal nerve, you get foot drop. And one another cause for foot drop is the outgrowth of the bone in the spinal canal or presence of a tumor or cyst which compresses the nerve, and in turn we end up in foot drop. Thank you.
The major symptom of foot drop is the inability to dorsiflex the foot, but in the initial periods, the symptoms could be much more subtle. For example, the person could be frequently tripping, or there could be difficulty in climbing up or running upstairs. Other symptoms also include pain in the stemming of dragging foot gait, in the lower back, the hips and in the knees. There could be development of corns, calluses or bunions due to flopping the foot in right and left directions. Also, the foot is weakened a lot, so the person is more vulnerable to tripping and falling down, which can further complicate problems when the muscles of the ankle and foot are not used. Sometimes when the nerve is damaged, there could be a buzzing sensation in the foot, but most of the time people have told that there is no pain during foot drop. But the symptoms, as they progressively become worse, the pain starts to develop. Thank you.
How is foot drop diagnosed? To diagnose the foot drop, the doctor will do a physical examinations and ask you about your symptoms. The doctor will also want to see how you walk and will examine your leg muscles for weakness and damage. The doctor may order certain tests including the followings: imaging tests including X-rays, ultrasounds, MRI, CT scans, and look for the injuries to the legs, spinal cords or brain. Blood tests to check the blood sugar level and to look for any potential toxins that could be causing the conditions. Nerve conduction tests to examine how the nerves are functioning. Electromyography. A test is which the electrodes are placed in the muscles of the leg to measure the electrical activity, how well they transmit the signals and sensations.
Talk about nerve injury. So what is nerve injury? Nerves are composed of small cells called neurons which help in connecting the brain and spinal cord to various parts of the body. and helping in aiding movements, sensations, and feelings. So, nerves are fragile, they can be damaged by pressure, stretching, or even cutting. Injury to a nerve will stop the signals to and fro from the brain and spinal cord and loss of sensations in the injured part.
So, what are the causes of nerve injury? It could be from something as crazy as a gunshot wound to an autoimmune disease like lupus or rheumatoid arthritis. But more commonly, it's caused due to compression of the nerve, which can happen during continuous exercise or even during an accident. Also, laceration of the nerves, contusions or severe bruising of the nerves, stretching or traction of the nerves. All of these can lead to nerve injury. Also, let it be known that today the most common cause of neuropathy is diabetes.
So there are two types of classification of nerve injuries. The first one is the Seddon's classification and the second one is the Sunderland's classification. So in Seddon's classification, there are three types of nerve injuries. The first one is the neuropraxia, the second one is the axonemesis, and third one is the neuromesis. So in neuropraxia, we could see the minimal compression of the peripheral nerves, and also we could see the breakdown of the localized segment of the myelin sheath. In neuromesis, the axon, squamosal, and also the endoneural tube is completely disrupted. The recovery for this nerve injury is not at all expected, and this kind of nerve injury could be seen in the gunshots and knife injuries.
Just like we have foot drop in the lower limb, there is a condition called wrist drop in the upper limb. In wrist drop, the main cause is radial nerve palsy. Due to radial nerve palsy, the extensors of wrist and digits are affected and we cannot extend them. If we take Saturday night palsy, the most common symptom of it is none other than the wrist drop. Even during the surgeries, many nerves are commonly injured. For example, if we take the facial nerve is injured in surgeries dealing with the inner ear and the cheek region.
Wallerian degeneration is caused when peripheral part of nerve cell is cut. This part goes through chemical and physical changes. The characteristics are this failure of conduction of nerve impulse, and the conduction of nerve impulse becomes slower. The features are nucleus is pushed to periphery, the cell body swells up due to fluid accumulation, and Golgi apparatus disintegrates.